right. Welcome to Mercy Medical Center, Redding. My name's Kimber. I'm the Joint Care Coordinator for our Center for Hip and Knee Replacement. And I'll be walking you through having this surgery, how to prepare for it, and getting through the hospital processes, and how to make arrangements for your recovery afterwards. This class is designed for anybody having a total knee or total hip replacement surgery. So that's the information that we're going to go through. Anybody having this type of surgery, I just want you to know ahead of time that you are well patients. You are not ill. You may have a condition that limits your abilities to do certain things that you would want to do. But you are considering well patients. What I usually say to everybody is you're going to leave the hospital with all of the tools and enough knowledge to go home and to start living your life in a better way. You get to do the things you haven't been doing for a while that you want to get back to. Maybe that's walking through Europe on a vacation or on a beach somewhere. Maybe that's simple things like walking without pain. Some people have big goals, some people have little goals, and they're all very valuable. The first step is the guidebook, which you all have in front of you. This, each person has both a knee guidebook and a hip guidebook, and specific to your surgery. And everything that I cover in this class is in that guidebook plus some. There's lots of information there, so please take it home with you and review it. Please take it also to some of your appointments when you go out to see your medical doctors as you're preparing for surgery, or your physical therapists if you're in some form of prehab before the surgery. Share this book with them so they know which program that you're going through and what we expect out of it. The next step is enlisting a guide. The guide is a close friend or a family member that's going to be going through this whole process with you. Very, very valuable. We've actually found that our patients recover faster, they go home earlier, and overall they have improved results if you have somebody that can help you out during this process. So you need to find a guide, but if you don't have a guide, that's okay. We're going to work with that. So some of the things that you're going to start doing before the surgery itself is making discharge plans. Here I am, you haven't even come into the hospital yet, and I'm already talking about discharging you. Well, most of our patients go home after their stay. So this is kind of important to get a grasp on before you go in for the surgery and get those things lined up. So have somebody available to drive you home. So usually 2 to 3 days after surgery is going to be your discharge day. So make sure that that person's lined up to be able to drive you home. The next step you can do before you even have surgery is get some equipment. Some equipment is covered by insurance and some isn't. I'll tell you the two key things for total joint surgery to have is a walker or crutches. We tend to use walkers more often than crutches. Crutches are a little trickier to use. Walkers are much more stable. Insurance companies usually cover the purchase of those, so check with your insurance company. Also, the other piece of equipment that is pretty crucial, especially after hip replacement surgery, is a bedside commode or a seat riser for the toilet. I'll get into a little bit later on into this talk about the hip precautions, and one of those is to not bend your hip joint past 90 degrees. So having this little tool is very helpful to make you do that. There's some other things that you can get also, little things that are typically not covered by insurance, but if you need a little extra assistance, things like the long-handled reachers. We give these out to all of our hip patients, but sometimes these are beneficial for knee replacement patients too. Sock aids, long-handle shoe horns, shower mat, that's very handy. Good safety tip to add some sort of non-slip surface in your bathtub or shower area. Most of these things can be purchased at various medical supply companies. Do give them a copy of your insurance so that they can bill to the insurance if it's covered. Or you could also go to places around the town, like different pharmacies that might have things like that also. There's also a lot of thrift stores that carry a surplus of these items that have been donated, and you can get them for very minimal cost. So that's a handy little tip. Now, if you don't get your equipment ahead of the surgery, that's okay, because we can always order the equipment and have it delivered right to your room before you get discharged. So that's something that the hospital can provide for you. And of course, we run it through the insurance company so that it's less cost to you. You will be told by the orthopedic surgeon that you need to be declared well before having the surgery. So there's a series of appointments that you'll be going to before the surgery. So seeing your medical doctor, that's definitely a requirement. Basically what they do is something kind of like an annual physical. So they listen to your heart and your lungs, check your vital signs, perhaps do some lab work and declare you good for surgery or not. So if not, then there may be some things that we need to work on to get you prepared for the surgery. So it may delay things a little bit. Now, if you see a specialty physician, such as a cardiologist in particular, that physician also needs to be met with. So you'll have that additional appointment as well. The anesthesiologists and surgeons here request that lab work's current 3 weeks before surgery, and then EKG 3 months within surgery. So if you get your lab work done at an outside facility and it's not within that 3-week grace period, then we will be redrawing those labs when you come in for your preoperative appointment with the hospital. So that's something to be aware of. If at all costs, you could possibly wait until that time comes around for your preoperative appointment with the hospital and get everything done all at once, one-stop shopping. Blood donation is something that your surgeon can talk to you about. In particular, if you've ever had any problems with anemia or blood disorders, things like that. So definitely check with your surgeon if you're concerned about donating some blood or receiving a blood transfusion. It is very safe. We can draw from a community blood bank, very screened for just about everything possible. So it is very safe to use, but just so you know ahead of time, it's pretty rare that we have to give blood transfusions in these types of surgery. That's a result of the techniques of the surgeon and how wonderful they are in the operating room. So not usually something you need, but if you're curious about it, please speak to your surgeon. There is an additional lab test, too, to check your blood type. It's required before every surgery. That's for that just-in-case moment. So within 7 days of the surgery, typically at that pre-op clinic appointment, you will get your labs done one more time just to make sure we know your type of blood. So if we need it, we can give you the right stuff. Now, in this whole process, as you're getting prepared for surgery, if you do develop any infections or cuts or scrapes that are close to where you're having the surgery done, please let your surgeon know. That could potentially postpone your surgery, or it could be something that we could do some antibiotics for, or something to where we can still go ahead with the surgery, but your surgeon needs to be aware of it. The time that I most see this happen is, you're a week out from surgery and you're running around your yard getting all of the yard work done, and sure enough, you're trimming the rose bushes and you scrape that knee that we're going to do surgery on. So be aware of that as you're preparing for surgery, and maybe wear some long pants, some jeans, something like that. Be aware of the little cats and dogs that like to jump up on you, because they could scratch you and that could potentially postpone your surgery. So little things to be aware of.